Hello, everyone. Thanks for joining today. My name is Dr. Kathleen Zacherl, and I'm going to discuss heart health and pregnancy. Heart disease is the leading cause of death amongst women, especially those of advancing ages. If we look at women of childbearing ages, it ranks at number 3. But in looking at pregnancy-related deaths, it goes back up to number 1. I'd like you to remember today that pregnancy-related deaths are rare, but it's important for us to prevent as many of these as possible. Heart disease encompasses about 1/3 of the pregnancy-related deaths, and if we include all cardiovascular conditions, it's 1/2. Pregnancy is a strain on the heart, so the heart works harder in order to pump blood to feed the growing baby. Some actually refer to it as like a cardiac stress test, and it gives us a window into the rest of women's lives to assess their heart health. It's good to know the risk factors for heart disease for women in pregnancy in order to advocate for yourself, to know the warning signs, and also to improve your heart health as much as possible. Racial disparities are present in many aspects of healthcare, but this is particularly highlighted in maternal health. Black women are 8 times increased risk of a pregnancy-related heart disease death compared to white women. Also of particular high risk are women of advancing ages. Other risk factors include obesity, preeclampsia or blood pressure issues of pregnancy, diabetes, substance abuse, and if you've been treated with chemotherapy in the past. If you're someone who's planning a pregnancy, it's important to optimize your heart health as much as you can. Ways you can do this is maintain a healthy weight, exercise, have your blood pressure checked, go for diabetes and cholesterol screens, refrain from smoking, and also if you're someone with an underlying heart condition, it's important you discuss this with your cardiologist and possibly with an OB high-risk doctor before you get pregnant, as this can impact your heart health and risks during pregnancy. The most common cause of heart disease in pregnancy is something called peripartum cardiomyopathy. This is a condition where the heart muscle weakens, it doesn't pump as well, and fluid can back up in the body. The normal symptoms of pregnancy can actually mimic the symptoms of heart disease, so it makes the diagnosis challenging, and as a patient, it can make knowing when to seek care challenging as well. It's also important to know that this condition can actually present up to 1 year after having a baby. So if you have some of these symptoms and you're seeking care, it's important to discuss with your healthcare team that you've had a baby recently. And the symptoms to watch out for are shortness of breath, especially if it's at rest or if it's worsening, if you're having a rapid heartbeat, if you need to use pillows in order to prop yourself up at night to breathe, if you have a new onset of cough or wheezing, if you have worsening fatigue, you're passing out, or if you have an ankle swelling, especially if this is more than 1 week after having a baby. It's also important to know that certain pregnancy conditions impact your heart health later in life. So women who've had preeclampsia in a past pregnancy are increased risk of stroke and blood clots about 2 times that of other women, and increased risk of high blood pressure 4 times. For women who've had gestational diabetes, you're 50% increased risk of diabetes later in life, and it's important to get regularly screened for this, as that can impact your heart health also. We've also found that women with preterm birth and preeclampsia are 8 times increased risk of a cardiovascular related death in your lifetime. So let's use this information as empowering to advocate for ourselves, to know the warning signs, and to optimize our heart health. Thank you for this opportunity to discuss this important women's healthcare topic today.